All right, I'm going to do the performing therapy activity. Before we enter the room, we want to grab the patient's chart. So I'm just going to look through the chart and the physician's orders. After looking through the physician's orders, usually you can grab the medication before we go into the room. All right, now I'm ready to go into the room. I'm going to make sure to wash my hands and knock. All right, I'm Tyler. I'm the respiratory therapist. Today we're going to be performing. And at this point, I would go and tell them about the medication, the treatment we're doing. Since we don't have one, I would just kind of make sure I told them, any side effects and what the medication actually does. And at this point, I would just kind of interact and see if they've done the therapy before or not. If they have, you can kind of just go on. If they haven't, kind of go more in depth and step by step. So say this patient has never done this therapy. All right, I'm going to get started here. I'm just going to check your wristband, make sure it's the right patient. And before we start this, I'm just going to grab your vital signs here. If you have to check their pulse, the respiration rate, and their SpO2 with a little thing, you can do that. All right, and I'm just going to take a listen to your lungs here before we start it, to see if there's any change. So we're just going to listen to the lungs bilaterally, and you can just breathe normal for me. All right. And at this point, we are ready to start the therapy. So I'm going to break this down. We're going to do 3 different devices. First, we're just going to start with the aerosol device, the most commonly used one, the nebulizer. All right, on this, I'm just going to hook up, hit the flow meter, and make sure there's a mist. All right, so on this, I just want you to kind of just softly put your lips around there and just breathe normal for me. All right, and during this, and tell them how long the therapy is. It'll take about 5 minutes or so. All right, and as they're breathing, just kind of keep examining, make sure there's nothing different or crazy or they feel really stressed and it's getting worse. All right, and at this point, you're going to just see, once you see hear any sputtering or don't see the fog, tap it, make sure you get all the dosage, and continue to let them go until it runs out. All right, now say, we're just going to switch and say we're using just the inhaler. I'm just going to say this is the inhaler, even though it's a nebulizer. The MD, or the MDI inhaler. But you got to make sure a patient can use an MDI. They're usually, the phone fell here. Alright, now usually these are a little harder to use. You got to make sure they can activate it and inhale at the same time. So on this, I just want you to again put your lips kind of soft around there, and when you actually activate it, push it down. You need to inhale at the exact same time to make sure it's activating the medication into your lungs. Alright, and then also at the end of that, I want you to swallow after you finish inhaling. Alright, you can go ahead and do it. Alright, and swallow. Alright, now again, I'm going to switch and say it was DPI, the dry powder. So on this, usually it comes a little round aerosol thing. So on this, it's just a little opening with a little dosage in there of dry powder. I just want you to put your mouth over and inhale big, and then that powder will go in. And again, just swallow for me after. And that's all you got to do. Alright. Okay, so we're done with the therapy. So after we're done with the therapy, I want to kind of have a big cough out of you. All right, and then I'm just going to take a listen to your breath sounds and get your vitals again here. So I'm just going to listen to their breath sounds, also check their vitals, respiration, the pulse, and all that. Then after that, I'm going to make sure that they're positioned okay, that there's no safety risk, them falling, make sure their call light's back in place, and ask them if there's anything else you can do. And then by the doctor's order, it'll tell you the next time that you'll have to give a treatment or if it's as needed. So say this treatment was supposed to be every 4 hours and as needed, I'd be like, okay, I'll see you in about 4 hours in the next treatment, the doctor's schedule. Or he also said it's as needed, so if you feel any discomfort, just tell the nurse or try to call and see if one of us could come in and we'll give you that treatment again. Just make sure there's, again, before entering, just be like, all right, there's nothing that you need. I'll see you later. So I'm going to exit the room. After exiting the room, I want to make sure from everything I recorded, the vital signs and the breath sounds, I want to get that charted. If there's any changes that you notice that were bad or the treatment didn't work, maybe you want to notify the physician, see if you can switch the treatment or the dosage or the time. Or if, if it's working, then it should be good to go, and we'll see them at their next treatment.